Good morning. My name is Dr. Hillel Mazansky, and my areas of expertise encompass medical hypnosis, guided visualization, nutrition, and exercise, my mantra being how to live a longer, happier, healthier life. My website is drdoctormedicalhypnosis.com, upon which are 23 different hypnosis videos for your consideration, as well as the blogs contain a wealth of holistic health and medical advice. Today's health tip is titled, Ways to Manage Your Chronic Pain. Chronic pain affects more than 100 million Americans alone. A pain that lasts for longer than 3 months is considered chronic recurring pain. The pain begins, whatever the cause, by signals being sent from the nerve endings to the brain. The pain may be of a short duration, such as in migraine. When they are free of the migraine, they don't suffer pain, or longer in duration, such as chronic neck and back pain, arthritis, fibromyalgia, and irritable bowel syndrome. Those are the main causes of chronic pain. Now, ways to manage the pain. The first line of defense usually is to use over-the-counter medications. And if these don't help, patients usually seek medical advice from their physicians, who try and investigate and find out what the problem is causing the pain, and then manage it accordingly. Most of the chronic pain sufferers do not undergo surgery, although this will be discussed later during the health tip. If the over-the-counter medications don't help, stronger and stronger medications are usually prescribed. Now, this can be very counterproductive, as they are addicting and toxic and have side effects. Some chronic pain sufferers even resort to drinking alcohol and using drugs, the combination of which can be lethal. Now, ways to manage the chronic pain are the following. First of all, physical therapy is the first form that's usually used by physicians, and by doing this, the areas are strengthened and stretched with special exercises and movements. Yoga is another form that can help, especially chronic neck and back pain and knee pain. Yoga has now become one of the recognized methods of treatment. A third way is acupuncture. Acupuncture is also comes to the fore, and this might be of benefit. Medical hypnosis is definitely a form that can be used, as it empowers patients to assist themselves in all the chronic pain situations as mentioned earlier. The patients do the hypnosis session twice daily after they see us. It is recorded for them, and they listen on their handheld devices, or those who purchase the videos over the internet listen to them, and after approximately a month to 6 weeks, they will notice that there's a marked improvement. Other methods, if the pain still persists, there are specific pain specialists that patients are referred to. Exercise can definitely help manage your pain. Now, some patients tell me that the pain is so severe that they can't exercise and they're confined to bed. Well, bed rest is counterproductive because the muscles become weak. And once the muscles weaken, that aggravates the pain. So just walking 30 minutes a day, even if it's slowly, helps secrete endorphins, which can help manage the pain. Resistance training, not necessarily with weights, but even just with rubber bands, as light as 5 or 10 pounds, can help build the muscles, and that building those muscles helps guard against prolonged pain. As a last resort, surgery might be necessary, but those who deal with chronic pain have all seen surgery is usually done in the neck or the back, and oftentimes the surgery fails, and patients continue after a while, the pain returns, and we've all seen cases where patients have undergone 4 or 5 times surgery to the lower back, especially. Well, the more times they have the surgery, the more times the pain can become chronic and ongoing. So there are other techniques that can be used. The pain specialists begin with certain shots, such as steroid shots, or they do a procedure called radio frequency ablation, where the small nerves that are causing the pain are cauterized or frozen using electricity. Sleep is a very important factor. Oftentimes, the pain is so severe that it interferes with the sleep. And patients with chronic pain also sometimes suffer from depression. And the worse that the pain becomes, the worse the depression becomes, and a vicious cycle develops. So sometimes it is necessary to use antidepressant medication for patients with chronic pain. Insomnia is best treated with hypnosis, because oftentimes, whatever the cause, the patients come to the office during the induction phase of the hypnotherapy, they fall asleep. And as I always say, hypnosis is side effect free and non-toxic. On my website, drmedicalhypnosis.com, are hypnosis videos for your consideration for neck and back pain, arthritis, fibromyalgia, and irritable bowel syndrome. Every person who purchases the video gets an ongoing 15-minute telephonic or Skype consultation, which is complimentary and included in the price of purchase. Your chronic pain, friends, need not go untreated. I've given you a list of some of the most common forms of treatment, and these can be used by yourself. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.